Okay, so I guess we'll get started. Welcome everyone. Thanks for taking the time today. My name is Kevin Noth. I am chair of the Canadian Landscape Association's Insurance Committee and president of Price Landscaping Services in New Brunswick, Moncton, New Brunswick. And today, and again, this is our second insurance webinar entitled Employee Benefits Town Hall Webinar. Today with the People Corporation team. People Corporation is part of the CNLA's Hort Protect Insurance Program as our endorsed broker for life and health insurance. I'm also joined by two of my colleagues and fellow volunteers with the Canadian Nursery Landscape Association, Carl Stenson of Sheridan Nurseries in Ontario, who, if he wasn't with this program from day one, I think it was day two. So we've been on it for a long while and very knowledgeable about everything insurance as a volunteer. And Leslie Cornell from Cornell Design Landscape. Thank you for waving, Leslie, out of Saskatchewan. Both Carl and Leslie will help with the Q&A at the end of this session, and we do encourage those questions at the end. So feel free to ask the questions, and there is a feature at the bottom of your screen. You could look there, Q&A. So anytime through the presentation, please type that in and we will address it at the end of the seminar. If it doesn't appear, just move your mouse around and it should come back up there. So at this time, I'd like to welcome Pamela Coos, who's with the Peoplecorp, and she's been involved for quite a while, and I've met Pam personally and has done amazing work with Peoplecorp. So Pam, maybe we get started and then you can introduce your fine team that's gathered here today.
Thank you very much, Kevin, for that introduction. We're very happy to be here, and if you give me one moment, I'm just going to share my screen and we'll get right into the presentation. So like I said, we're really happy to be here. I've got a full team. There's 6 of us in total on the call. But one of the things I want to start off with is this backdrop. That the reason why I put it up here, while we haven't had the opportunity to be in person recently, this is our backdrop that you would see all across Canada at our booths for the trade shows that we'll be attending. And I just wanted to put there as a reminder of who you are in case you kind of forgot who we were. That's your reminder. The other thing I want to address today is the hortprotect.com website. It's a great resource to go to get more information and also to connect you with your local benefits consultant. While I have myself and Laura on the call, there are still 6 other people who are benefit consultants all across Canada, and they're regionally based. So the best place to go to get that contact information would be to the website. Today, like I said, I'm joined with 5 other colleagues, and the reason for today's call is to give you guys an overview of the program and what's available to you through the Hort Protect. As Kevin said, we've been in great partnership with the CNLA, and we are the member savings program, and so we want to kind of walk you through the different things that we're not just looking after your dental claims or your health needs or prescriptions being fulfilled. We come with the great resources available to you, and we want to walk you through those today. A little bit of the history of the Hort Protect program. It's been around since 1984, and we at People Corporation have been the original benefits consultants. For those of you that have been around since 1860 or 1960, oh my goodness, 1984, would know that People Corporation name wasn't the original name. It would have been under the Investment Guild, but today we function under People Corporation. We are the largest insurance program in your profession, and we have about 350 plus members, equating about 2,600 employees with the program. We're supporting you locally in your provinces, attending different, whether it be golf tournaments, trade shows, conferences. We're there to support you and help you along the way, and we continue to want to do that as things start to open up. But for now, we live in the world of virtual along with you. One might ask, why choose the Hort Protect program? And what is the difference between coming with us in our program versus another broker and another carrier out there. Because of the longevity of the program, it's been able to work with, in conjunction with the carriers, and understanding that there are some nuances that you guys are faced with that you wouldn't necessarily have privileges or rights to, because they would want more out of it. An example being that this is a group program, and if you were to come onto it, you only need one employee to join the program. That's unheard of to get group benefits for one employee. So this is a nice thing to have for your profession. No medical evidence is required on the onset and with setting up the group. One of the other nuances that you guys are facing in your profession is the seasonal benefit coverage, where the carriers don't always understand what that means. But again, because of the long-term relationships in which we've had with yourself in each province and with the carriers, we've been able to implement and have sustainability in that, where we can have coverage remain in place and or we can turn it off if you need be. Our benefits program also includes out-of-country coverage, which is a key thing for all of us. I mean, right now we're not currently traveling a whole lot, but when we are up and running, it's fantastic to have this in place where you don't have to go seek additional individual travel insurance, because it's included in your program. And this year we're excited to announce that we have the trip cancellation coverage now in place. I alluded to earlier on the call that I'm joined with other colleagues, and at this point in time, I'm going to hand this part of the presentation over to Laura. Laura is one of the consultants here based out of Ontario, and she's going to walk you through some of the product lines and how we can service you. Take it away, Laura.
Thanks, Pamela. So as Pamela mentioned, with the amount of companies that are in the plan, we obviously have group buying power for the benefits that we're going to discuss, as well as preferred pricing and usually coverage enhancements that companies cannot get standalone. So life insurance and accidental death are great peace of mind tools for your employees. So if something happened to them, they would know that their families and dependents would be taken care of. Health and dental is a great way to support the day-to-day health of your employees. It's a tax-effective way as well to attract and retain your employees. So there would be coverage for things like prescription drugs, paramedical practitioners, such as social workers, massage therapists, chiropractors. Pamela discussed the travel insurance as well as the trip cancellation, which is a great perk for many people to use. Disability insurance would be income replacement benefits. So short-term disability, which would pay a percentage of income similar to EI, as well as long-term disability insurance is also available through the program. That would be for a major illness or injury, whether it happened at work or not, it would be covered through the plan. EAPs are a great enhancement to the health and dental coverage as well. So if someone was dealing with a catastrophic issue in their life or in the workplace, there would be short-term counseling for free available to your employees as well as their dependents. The other thing we'll talk about after on the next slide is a healthcare spending account. So there are alternatives to a traditional set plan that we will discuss and some of the advantages of that. The other things on that slide, sorry, Pamela, my team will discuss those further. Those are other perks that are built into the plan. So we'll touch on those after. You can go to the next one, thanks. So a healthcare spending account is essentially a fixed amount of money that an employer puts into a flexible spending account for their employees to claim any CRA eligible medical expense. There isn't any set plan design like there is in the traditional plan. So people have a little bit more flexibility on their own health as well as the health of their dependents. It's really a fixed cost, so it would never increase unless the employer decides to allocate more money to that account. And employers as well, it's a pay-as-you-go account versus a monthly premium style. So if there's money left over in the accounts at the end of the year, it could be the employers to keep, or they can allow their employees to roll it over 1 year as well. It can also be integrated with a traditional plan as well to allow a little bit of flexibility for additional things that aren't covered in the fully insured plan. That's it, Pamela. Thank you.
Thank you very much, Laura. As we discussed, we have many different facets and different departments that are underneath People Corporation that are a part of the Hort Protect program. And this next one, we're going to pass it over to Louis, and Louis is to walk us through what he has available to us through Collage HR. Go ahead, Louis.
Thank you, Pamela. Hello, everyone. My name is Louis Custodio. I am the Director of Sales for Collage Technologies. Our company started in Canada in 2016, and we're a Canadian group that built Canadian HR software for Canadian businesses. We, since 2019, have been a wholly owned subsidiary of People Corporation, and our main solution, Collage HR, including an important add-on, the payroll sync option, is available to Hort Protect members at no additional cost as a part of the plan. So let's go through some of the features on this slide here. I just want to highlight that, since 2016, we've achieved a leading position in this space in Canada in the HR solutions for small and mid-sized businesses, of which we're very proud. And so let's go and take a look at some of the features. All right, so I want to zoom in on landscaping and related businesses today. The main uses for a solution like ours in the industry, and this is from experience, we already have some CNLA members as clients of Collage, and it's first of all about the ability to, on a digital process, no paper involved, very convenient for the employer and the employee to be able to hire, terminate, and reinstate employees, rinse and repeat as many times as you need to. I know that in this industry, employees come and go as the seasons come and go sometimes. We make it really easy for you to collect digitally all the information you need to collect from someone that is joining your team. And then when it's time to let them go, the process is also easy. And it makes it even easier if you're going to reinstate someone next season. So that's number one. Number two is connecting with payroll. If you're going to go through that process of collecting information for HR purposes, you're also going to, in the same process, collect all the information needed for payroll processing. And we can make it so that you only enter information in once, and all the information collected in Collage HR is automatically shared with your payroll provider. And I'm not talking about changing payroll software. Keep what you have. That's how we work. And we support multiple platforms in Canada. Think ADP, Ceridian, WagePoint, Payworks. There's a number of them, most of the online payroll software. So you can keep your payroll as is if it's working, but just connect it with this platform that will be collecting and maintaining employee data. And the third point is share it with your team, which means, essentially, you wanna make sure everyone can help you keep things up to date. So now on to a little bit more detail. So for hire, terminate, reinstate, it includes digital collection of all data and e-signatures. So if you have contracts, documents you need to sign to employees, HR policies, dress code, all those documents can be included in a welcome package for the onboarding of an employee, and they'll e-sign the documents, which means you can hire people from anywhere in the country and even outside of Canada and have them complete all that information in advance of their first day of work for you. There's a ton of automated reminders for administrators and for the new hire to complete the process on time. And it's very easy to delegate tasks. Every time you hire someone, you need to buy uniform, you need to buy tools, you need to buy to set different things up for the first day of an employee. You can share those tasks in your team and control what's being done and make sure that everything is done on time. Next, connect with payroll. So you keep the payroll software you have as long as it's one of the ones we support. And like I said, we support most online solutions in Canada right now. There's a number of them I mentioned there. You eliminate the double entry, so you don't have to do one process, one data collection process here for HR, and then a separate process for payroll. It's all in one place. Reduces a lot of risks of forgetting to do important things, but also just the simple chance for clerical errors, things like typos or anything like that. So just reducing double entry is a huge step ahead in terms of avoiding mistakes. And then finally, in terms of sharing with your team, this means that employees can themselves log into the platform. They can use a laptop, they can use their smartphones to log in, and they will help you keep information up to date. It's very common that people they move and different things change in their lives, and they might not remember to always give you that kind of update, and it's important information that you may need to update on your payroll software and also in your records and so on. So a platform like this, where they log in every now and then to do different things, helps them remember that they need to communicate those changes to you. We capture everything digital. It's also a way to offer transparency and convenience to employees that is much appreciated by them. And the documents that I said you can collect these signatures on at the beginning when you hire someone, you can send out updates at any time. So if you have a new HR policy, or if you have a COVID policy that's changing, you can send a document to all employees through the platform, get all of them to e-sign it, and those records are kept digitally in the platform automatically for you. So it just keeps it, makes it much more simple. All right, and so just a quick note on the data security aspect of our platform. I think this is one of the big points. If you're thinking, when you think about an HR platform, I think a big barrier to small businesses is, do I really need an HR software? It's really about the basics. And one of the biggest concerns that you should be thinking about is data security. When you employ someone, you hold a lot of sensitive information about that person: bank account, SIN number, contact information for family members in case of emergency. All of that sensitive stuff, you don't want that to be misplaced. So if it's paper files in an office, it's at risk. If it's files in your local computer, it's also at risk. If you start using a platform like ours, you collect and store information digitally, and all that responsibility now is transferred to us, and we do a great professional job of securing the information for you and sharing it with your employees appropriately, so they help you keep everything up to date. So it's really about the basics, and this is a big aspect of why you should consider joining the platform. And then last but not least, Collage HR is then included for all Hort Protect members. If you remember, it's $120 a year per employee. That's what this solution costs on retail. So if you remember, you're leaving money on the table. Unless you have another solution and you're happy with it, that's totally fine. But if you're not doing things digitally the way we're discussing now, do consider learning more and joining us. And if you're not, of course, a Hort Protect member, then look into learning more about how that can work out for you. And there's my email address if you need to contact me for follow-up questions beyond today. Thank you.
Thank you very much, Louis. And also as a reminder, I had mentioned to visit the hortprotect.com website. On there, we also have a link for a tutorial that you can click on and watch at your convenience.
Exactly.
Moving along, understanding that the reason why an employer would put benefits in place is because they obviously care about their employees. They care about the well-being of them, and to be able to assist, whether it be helping them financially with any kind of medical needs that would arise, but just giving them assistance. And looking at it from the holistic approach, we have Judy on the call with us, who will be able to walk you through the My Wellness of the Hort Protect program. Take it over, Judy.
Thanks, Pamela. Good morning. So we understand that in your business, people are busy doing what you do. So you are busy as in the landscaping business, you're busy in the nursery business, and you often are smaller businesses without a lot of time to work on wellness. So what we've done is included My Wellness, which is wellness and health promotion and communication. I realize I just started talking without saying that I'm the Vice President of Health Solutions here at Peoplecorp. And so what we've done for you is include My Wellness Connection. These are monthly communications that you should all be getting as part of being a member. And that will include a Did You Know poster, nutritional and health information. We'll also send you in April a whole pre-made wellness week ready to use, as well as regular campaigns around cancer awareness and kits in that regard. So you should be getting, this should look super familiar. If you're part of the program, you'll be getting something that looks exactly like My Wellness Connection, with the Body Bulletin newsletter, the Did You Know, and the recipe of the month. And that really gives you an opportunity to share with your employees, whether it's 5 employees or 100 employees, you can share with them this wellness information. You can request it from us in English and French. Most of you are probably getting this in English. And you can look as if every month you've taken a lot of time and effort in putting together some wellness information. The other thing that we've included, because we know that everyone is busy, is Self-Help Works. And this is a suite of cognitive learning programs. This has been super important during COVID as well, because people are not going in and getting therapy and doing what we might have done previously. So, sorry. All right. So these are wellness learning programs that focus very much on two things. One is behavior change, and the other are high-risk health habits. So it focuses on reducing alcohol, getting walking and starting to manage your weight, smoking cessation, managing stress, and Living Easy has been a very popular program for the last year. Living Lean, which again is specifically on weight loss, living well and managing your diabetes, as well as a sleep program, which has been so relevant, especially through COVID, with so many people dealing with issues around mental health, sleep, and stress. So these are all included, as well as the My Wellness Connection, the Self-Help Works is included in the program for everyone to use. The other optional add-on is People Connect. People Connect is an online mental health tool that enables members to get direct access to therapists. So if you have paramedical benefits, we found many people were not able to find a therapist. So they wanted to see a social worker, a psychotherapist, and it was very hard. So organizations were saying, how come our mental health claims are going up and yet people aren't using their mental health benefits? So what we did is we created People Connect, which includes a mental health knowledge forum and blog, a diagnostic self-assessment tool, and then access to therapists at a preferred price. Should the therapist and the member decide that they could benefit from psychiatric collaboration, we have a sub-network of psychiatrists. And anyone that's tried to get an appointment with a psychiatrist in our country will know that that's going to take you anywhere from 6 months to a year. So this expedites your care to a psychiatrist, and it also gives you really affordable therapy, $75 an hour, or $35.50 if it's a half an hour, and you can match that up to your paramedical benefits and submit for your claim. So it really removes barriers to people getting the help that they need. We know that mental health has been a huge issue, especially during COVID, and we feel with our My Wellness Connection, Self-Help Works, and People Connect, it's a nice group of services. This one, People Connect, you can choose to add to your program at 85 cents per month.
Thank you very much, Judy, for that presentation and the value that it brings, that we're able to, the employers can extend down to their employees from that holistic approach. Moving along, being part of the People Corporation family, we've heard from different departments. Now we're going to talk about People Advantage. And we have Lorna, who's on the call with us today, who will walk us through the savings and access of services at preferred pricing through People Corporation.
Thanks, Pamela. Hi, everyone. I'm Lorna Rempel, and I am a product manager here at People Corporation. I support new product development, and I manage the Preferred Provider Network. It's my pleasure to be able to present to you our Preferred Provider Network offerings today. So let me start by asking you this. Who likes to save money? I'll bet that if I could ask for a show of hands, everyone would have their hand in the air, because we all like to save money wherever we can. So we've branded our Preferred Provider Network as People Advantage, because our program brings you many advantages through discounts and promotions at a variety of vendors across Canada. We have 4 areas that focus on our offerings. And the first is the Preferred Pharmacy Networks, which include Rexall and the Sobeys chain of stores, along with online pharmacies such as Pocket Pills and TELUS Health. The second offering that we cover is brand name prescription benefits, which provide access to programs that can assist with covering brand name versions of prescription drugs. The program also includes medical services and therapy. We have a program as well where you can save on vision care expenses and discount for speech therapy that's targeted for children. And then finally, the program offers discounts and perks through retail shopping. I'll speak to each of the offerings at a high level today. You'll notice that the first two offerings under the People Advantage program focus on savings for prescription drugs. So let's start with the prescription drugs first, if we can move to the next slide. The People Advantage program has negotiated savings on both dispensing fees and markup with various pharmacies in our network. We have a few pharmacy chains taking part in the People Advantage program so that you have the option of choice. Rexall, the Sobeys chain of stores, Metro, and Food Basics will combine to provide savings nationally, with the exception in the province of Quebec. There's a regulation in Quebec that states that we are unable to promote one pharmacy over another within that province. So in essence, discounts cannot be negotiated or promoted there. In addition to storefront pharmacies, we also partner with mail order pharmacies. Pocket Pills, TELUS Health, and Sobeys by Mail all extend discounts. In addition to the discounts on dispensing fees or markup, they may offer free delivery, and depending on your location, you might even be able to receive your prescription drugs the very same day. The discounts offered under these pharmacies, both in-store and through online mail order, will vary based on the negotiated agreement. But on average, you can expect to save 6 to 7% on the pharmacy markup of prescription drugs and up to 6% $6 per dispensing fee. But again, that depends on the pharmacy chain. The People Corporation or People Advantage program also provides savings if you require brand medication. Most benefit plans will limit coverage to the cost of the generic version of a prescription drug. However, RX Help One and InnoviCares, you may be able to receive brand name drugs that are subsidized for a portion above the cost of this generic drug. And finally, moving on to our next slide, the People Advantage program offers savings on glasses and contact lenses through Iris, which is a growing optical company here in Canada. And in addition, Tiny Eye offers discounted services for online speech therapy, which is geared towards children. The savings here are not purely financial. Parents can save time and effort from driving to appointments by allowing their children to take part in online speech therapy from the comfort of their own home. And finally, to touch on the retail savings that are offered under the People Advantage program, there are discounts on in-store pharmacy products or other perks such as additional Air Miles coupons offered through Sobeys chain of stores. And now here's the best part. It's super easy for you to access the discounts under the People Advantage program. For prescription drug savings at pharmacies and online, all you need to do is provide your benefits card or the information on it. For other benefits, you're provided with a link and a code that you can use on the provider's website to access savings or print a savings card that you can carry with you. These savings help both you and your employer to reduce the cost of benefits and improve your health. So I encourage you to take full advantage of the offerings. And thanks, I will turn it back to you now, Pamela.
Thank you, Lorna, for that update. There are a lot of great resources. I do hear back from people who are with us of how they're appreciative of it, and so it's fantastic to be able to offer. Moving along to the digital platform, as it is the world in which we live in today, and most of what we've talked about, everything has a digital component of it. Last but definitely not least, Janice is here, and he's going to walk you through some new enhancements, something new that came onto our program September 1st. We're excited, and I don't want to spill anymore. I'll let him take it away. Go ahead, Janice.
Thanks, Pamela. Hi, my name is Janice. I work with the client as a client conversion manager on our transition team on the back end of Peoplecorp. So I've had the pleasure of speaking with some of you here and there, or you've probably seen my name in the background on an email chain somewhere trying to get something sorted out for you. So I'm going to walk you through kind of the whole process and the new platform that became available widely on September 1st for CNLA. So the whole point of the digital platform and the change was really a transition for our collective digital future and building tools that will help support yourself as plan administrators and sponsors, as well as your members in the long term. The whole point of the transition was to enhance the current user experience and offer you the tools to kind of get these things accomplished, while understanding that also this is the first phase and we're continually looking to improve the platform that you're now on. We can go to the next slide, please. Thank you. On the employer side of things, there are improved access to reports. So previously you may not have had really any access. Now there is quite a bit of historical reporting available to you, as well as direct access to your billing files that you can pull yourself, and more to come in the future as well. If you'd used the previous system, you would have noticed that any changes that you would have made in the past would sit there pending for a while, and you'd be wondering, well, what's that going to look like on my bill? Or is it going to go through in time? Now the changes are done in real time, and you'll see the adjustments right away, which is great. Makes it easy for you to update payroll the same day versus saying, oh, shoot, I forgot to do that last week, and go back and check. So really excited to offer that as well. Along with the change, there is upgraded automation. So things like overage dependent notifications, non-evidence maximums if they apply to your plan, as well as termination ages or coverage reductions. All that's automated by a system now, and notices go out directly to your employees for that, which is great. Next slide, please. Thank you. On the employee experience side, so they can still, submit claims online and that sort of thing, but there is a lot more visibility offered on their new member portal. So they can go in and obviously add the direct deposit as they would have been able to do before, but there is more access to things like coverage details, including their benefit maximums, balances, and claims history. They can customize their dashboard as well as they go and use their benefits. So if they're going through, let's say, a bunch of sessions for chiropractors, for example, they can kind of keep that up there. And once they hit that maximum, they can take it off and put another benefit they're using just for a quick at a glance information. There is also reporting they can download for income tax purposes. So depending on if they want to do it themselves, or maybe their accountant is asking for receipts or proof, it might make their lives a lot easier come April when taxes are due and we're rushing last minute to get those done. There's also direct links to value-added services. So things like that Judy had touched on. So if you have Peopleconnect, for example, or even your EAP programs, if you have it, there are direct links out to those websites from the member portal. So one less website or URL for your members to remember, just one-stop shop. They can go in and click out to these sites as needed, which is great. Obviously, this is all based on a desktop application, but there is a mobile app version as well. It's available for Android and as well as Apple devices. So there is that available if you want to submit claims off their phone. A lot easier to take a picture of receipt as you leave your provider's office versus going home and using a scanner sometimes. So that's available to them too. So super excited. If you're on the platform now, everyone has the opportunity to register both on the plan admin side and the member side. So if you haven't done that yet, or if your members haven't done that yet, let us know. We have materials, we have recorded webinars, we can host things. We're happy to support and kind of keep you engaged as we embark on this digital journey. Thanks, Pamela.
Thank you, Denise. That was a fantastic presentation to all my colleagues for giving the update of how in-depth the program is. And we just want to thank you once again for the opportunity to share this with you. And at this point in time, I would like to hand it back over to the chair, Kevin, and we can maybe go through some Q&A if there's any questions that have come in through the presentation. Thank you.
Great, Pamela. So first of all, thank you to everyone for the presentation today. Like she mentioned, we'd like to move to a period of question and answers. So if you have any questions, please type them in now and see if we can get some answers for you while this webinar is going on. And I do apologize. There was, when I did the introduction, I forgot bringing up all the new features because I can say as a plan user, there's been a lot of changes in the last few years with this program and a lot of benefits, and Collage HR just being one of them that I can see. So not sure how the group feels, but if you feel like you just drank or just got fed through a fire hose, we can certainly understand. There's a lot of information there. So we have one question from Joel. Let me read that. Does Peoplecorp have any data on how a benefits program helps recruitment and retention for small business? So who wants to take that? But this is speaking as an executive director, so he's looking at from that point of view.
Sure. Joel, I can go ahead and answer that question. I don't have statistic numbers to give to you today on the call, if that's particularly what you're looking for, but I will say it is a common tool that is used to retain, to hang on to their employees, because more and more it's growing and more companies are adding benefits. And then what also is happening is if when they're just hiring them, if they don't have it in place, they're calling me and they're saying, okay, the time is now, we need to get it in place because the people we're hiring are asking, they're almost driving our hand. So it is a growing trend, I'll say, that is out there in your profession that companies are adding.
Okay. I was going to wait for a few more, but one in the meantime that kind of was brought up, because as we all know, or some people, maybe some new people don't realize, new members, but there was a previous program with Manulife, and now we've switched over. I know it's not called SSQ, and I'm sure you have to update me. Beneva. So Beneva, right? Sorry. So can you explain the difference between the previous program with Manulife and the new program with Beneva? And like, will members see any changes due to this changeover? Is that
so? Yeah, I'll take that question as well. Basically, what has happened is we've changed the carrier. So going from Manulife to Beneva, the coverage in itself as the plan design is remaining the same. There might be some minor differences between what Manulife standards would have been to what Beneva standards are, but if anything was to come across, it would be enhancements for the plan members. For those of you that are with us and have gone through the transition pains, because I will get ahead of that, there have been some transition pains where maybe some of the proper coding wasn't active on the new Springboard platform that Janice was just talking about. You might have heard some hiccups along the way, and potentially there have been some claims that were being declined. It's not because the coverage is actually being not mirrored, it's just because on the back end, the information being fed over. So we've been able to investigate and rectify that your coverage is still going to continue the same as it was before.
Pamela, just on following up on that, Manulife is a well-known name. Everybody has heard of Manulife before, and really nobody's heard of Beneva before. And I know where Beneva came from, but maybe you can explain how long Beneva has actually been around and what the name change was.
Sure. So Beneva has just recently come into existence because it was the acquisition of the joining of Le Capital and SSQ. So this is why the name Beneva is not going to be known to many out there. Being that Le Capital and SSQ have been around for numerous years and also have a great reputation, maybe not known as well as we all know Manulife in the industry, it too is up there with the 5 competitors. And so we feel as People Corporation, this was a very strong move to make, and we would never move or position any of the group over to someone that would not be able to undertake the size of this group. As I had alluded to at the beginning, this is a very large association plan. So that being said, it has strong strengths and credibility behind it, but this is the reason for the new name is because it was the buying of SSQ and Le Capital joining to become Beneva.
So I have a couple more questions here, Pamela. The first one is with Collage. The question is, Collage, will it do payroll? We are currently using Deluxe Payroll and would be interested if Collage could be a one-stop shop.
Excellent question. So what Collage does is there's 2 service levels. The one that's included is the payroll sync. So as a Hort Protect member, you get that at no extra cost. So you get the full HR suite, and then the payroll sync means every time you update an employee's salary in the platform, we take that information over to Deluxe Payroll for you, so you don't have to do the double entry. Every time you hire someone new, that new employee profile will show up automatically, as they say, in your Deluxe Pay web, right? So next time you go in to run payroll, it's going to be there for you. So that's the payroll sync. That's what's included. It works with Deluxe, no problem at all. Now, if you're looking to outsource the processing of payroll, if you're that person that, every 2 weeks or so logs in, runs payroll, remittances, payments, and then year-end reconciliation that's coming up, which is a little painful, and then T4s, ROEs, all that process can also be outsourced to our team. That is a separate service. We have that available, but there would be an extra fee. So you're not paying the HR and the payroll sync, but if you want to outsource processing of payroll, we can help you with that as well. And then yes, Collage would be your total one-stop shop. And just so you know, it is the most popular option we have right now. Most of the clients that sign up for HR end up syncing their payroll first, and eventually they outsource processing as well. It's the only way to get total peace of mind if you don't have a full-time HR person or a full-time payroll specialist on your team. You just outsource it to our team of specialists, and you go from running payroll and doing all that to simply approving reports, and everything else is on us.
Okay. Another question, and I assume this is back to the Manulife SSQ or Beneva. And basically the question is, what was the reason for the change? That might be back to you, Pamela.
So part of overseeing an association plan, we have due diligence as brokers, as consultants, to make sure that we are giving the best advice to our clients, and our client being the head office CNLA, who oversees this program. And we report to the CNLA Insurance Committee. And so it was that time of year to do a go-to-market and to be able to see what was out there for the best interest. And after a thorough audit and a report then which we brought to the committee, it was decided upon by the committee to make the move because it showed favor to the end users. Also with the benefits of being able to sync with the new things that are happening with People Corporation here as well. So I guess the long answer to say that is it was part of our compliances and of what we did. It was reviewed and audited and agreed upon by the committee and ourselves as consultants at People Corporation that this would be the best move to make at this point in time.
Pamela, I could add one more thing to that, is that Manulife was looking for a fairly large increase in premiums. And when the competitive bid came in from Beneva, there was not the same large increase in benefits. And Manulife had been increasing benefits for the last, premiums for the last few years without really much history or background telling us why. We might have been paying for the hurricanes in the United States, I don't know, or something, but our premiums were going up, and we couldn't allow that to happen continuously for our members, because our members are getting beaten up with price increases all over the place in raw materials and labor and everything else. So it was a move basically based on, could another company do the same or better for less? And it was proven that they could.
So Leslie, I think you had a question.
I do. It was about the health spending account, and for the employer, what does that look like? Is there a set amount that's recommended as a starting point? Or I'm sure there's no limit to the top end, but where would an employer start with that?
Laura, did you want to answer that, or would you like me to?
Sure, I can answer it. I would say there's not really any, there is an upper limit per se from CRA, but employers can do whatever they want, $100 if they're supplementing maybe a fully insured plan to cover off vision or something like that, or they can do different amounts by class, maybe like a management class versus employee class. They can do a set amount. So there's complete control and discretion of how much an employer would like to do, up to like a CRA threshold, maybe 10,000 or something like that would be an upper limit.
So it wouldn't specifically be just a specific type or part of the insurance, say dental, or as you say, optical. It's up to employer choice.
Yeah, any CRA eligible expense can be put through the healthcare spending account, or an employer can put parameters on it that maybe they only want to pay for dental claims, maybe they only want to pay, or if they can put, let's call it controls in it, or they can leave it completely open-ended to any CRA medical expense.
And then how does that affect the other basic insurance? Then does that go up or down in the cost to the employer?
It doesn't have any bearing, right? So if you have a traditional plan and maybe you have 80% co-insurance on things and somebody wanted to put that extra 20% out of pocket through the healthcare spending account, the employer knows their monthly premiums, they know their fixed cost of a healthcare spending account. So, you know what I mean? They only know the upper limit that the employees can claim. So it doesn't, you know, or standalone too, there's no bearing. They just have an upper max.
Okay, and I assume that when a person were to get a quote, that they would go into that and find detail and fine tune that to their company.
Yeah, for sure. They can specify if people can roll it over or not, depending on if you want to pre-fund it monthly to put budgeting into play, things like that. There's lots of customization available when they're doing a proposal.
Excellent. Thank you.
No problem.
And I wouldn't mind adding to that. Thank you, Laura, for that explanation. When it comes to setting thresholds of amounts, you take in consideration that you have single and family employees, and then what I'm often asked, well, how much then would I give to a family? So traditionally speaking, you would do 2.5 times the amount that you would give a single employee. It's traditionally what happens. I mean, it's up to your discretion of how you want to do it, but that's kind of what you see industry standards. And when it comes to from a budgeting point of view, I want to note that the cost to the employer would be the amount in which they want to give them for that benefit year. So an example I'm going to say is $500. Then the administration fee that's added to that is 10%. And then the provincial taxes, being that we're all across Canada, whatever your provincial taxes are on top of that. So that would be the overall fee or cost, I should say, to the employer. Now, if for some reason your employee does not have any claims that year, then there's no cost to you as the employer. If they submit $400, then you're only charged an admin fee on the $400, what's actually used.
Okay, good answer, Leslie. Yeah. I just see if there's any other questions coming through. I was going to ask a question just on healthcare spending accounts. I mean, I heard of these a few years ago, and I think it's a great option for some people, not for all. Maybe it's just a weird question, but has it taken off much in the last? Have you seen much uptake in the last year or two on our program, or maybe it's a moot question? I'm just wondering how popular they are. Is it just? Yeah. I guess the second point, just bigger companies or all size companies?
One of the things to understand about a healthcare spending account is its niche market. And yes, has there been an uptake? Yeah, there's the buzz has been out there of healthcare spending account. And predominantly what has driven the reason for people to inquire about a healthcare spending account is when you hear comments like, we pay increasing premiums year over year, like Carl had just said, and my employees don't even use it. They don't go to the dentist. They don't wear glasses. And so now I'm paying these premiums and it doesn't make sense. So this is where you would put in place a hybrid offering where you'd have a fully insured for any kind of unforeseen incident that might happen. So this would be the health component for the drug claims and whatnot. If you choose to put in the hybrid, you would maybe remove the dental and remove the vision care. And then you would say you would get $500 a year or $1,000 a year, whatever that figure might be. So you're not paying the dental premiums anymore. You're allocating a set amount of dollars into a healthcare spending account. One of the things to note that when you're going to a healthcare spending account, you're actually defining its maximum. It's no longer unlimited like fully insured. So things that you might choose that your employees would have coverage for the unforeseen under a fully insured program will have a maximum. It's just like if I was to take a fully insured program, put a drug max of $10,000 on it, it's available. We can do that, no problem. But if one of the employees happens to get a high-costed drug that's over the $10,000, it no longer is going to be covered through the program. So those are one. It's not the two are not the same. They meet different needs. And as long as you're clear when we set this up with you, and some employers just say, you know what, we can't go fully insured. We want to, but we can't. We just financially can't do it. We want to offer something. So then they may just strictly only do a healthcare spending account. And that's where you start to see maybe on new hires coming in, they haven't been there for so many years of service, so that they'll start off and then maybe graduate as they go up into different tiers or different classes. So there is a growing trend of healthcare spending accounts out there. There's per se nothing wrong with them. You just need to be fully aware if you're coming off of fully insured, the liabilities that are attached to that, and if you're looking at the hybrid between the two.
Okay. I'm just going to put a shout out. If anyone has any other questions, please type them now before we wrap this up. Don't want to leave any questions not answered, but I have one little one that anyway, so I guess it's obvious that we all want to start traveling. I should say obvious, but maybe I'm the only one wants to start traveling soon. So I guess what will be covered in that new it's cancellation insurance, but just that overall travel policy you have?
Yeah. So the travel policy is your standard travel policy that if there's any pre-existing conditions, you have to be stable 90 days before you travel. So that is standard in the industry with any, and that was there prior with Manulife and will continue to be with Beneva going forward. The difference that each trip when you go out, there's coverage up to $5 million for every time you go out, and it's for medical reasons. Okay, so we're talking if an unforeseen medical issue was to arise, you would have coverage for that medical care. And then in addition to this year, adding on the trip cancellation, we never had this in the past, and this is $5,000 per trip if your trip had to get canceled. Coverage there for that. Now, each and every member will get a benefit booklet detailing fine lines of the travel, because I have to go through it all. It's a long list with you today. I really give you a high overview, but you don't need to go out and get additional, I won't name another carrier, insurance coverage. You can choose, and often before what we used to say, if people would want travel insurance, we would often say contact whomever your credit card companies with, because they offer travel trip cancellations. So now no longer do you have to do that.
Was there some kind of provincial thing in that too? Provincial coverage, like up to, isn't every province different, or am I thinking something else?
Yeah, thank you for reminding. No, it's fantastic, Kevin. So the previous coverage was 90 days, which was a great coverage for those who like to be off work for 90 days. And I often say, can you hire me if anyone who is doing that? But with this new transition that has happened, the program is mirroring the provincial limits for travel. So depending on which province that you reside in, it has different limits. So here in Ontario, we were up to, I think it was 214 days it went up to. So it changes, and we provide you the update, the links to your provincial travel regulations.
Okay. I know it gets kind of confusing, but I just remember something about that in the discussion. So I'm not seeing any more. Sorry, Carl, go ahead.
Just adding on to the travel, there's been a lot of question and whatever. I know everybody I've talked to when they're thinking about traveling are wondering if they don't think their plans cover COVID. And it certainly wouldn't cover you if you had COVID before you left, but if you're away and you contract COVID in another country, I believe we were covered under Manulife, and that is carried over with Beneva.
That's correct.
So that's another, a lot of people think that it's not covered, and it is. So that's another good benefit. Not that we want to get it, but we want to travel.
So I'm not seeing any more chat or question and answers. So unless something pops up here in the next few seconds, we'll probably wind this down soon. Do you have any other questions, Carl or Leslie, before we do that for the group? Or any other comments? So I guess based on that, thanks everyone for joining, especially our team at People. There's quite a diverse team here, and they all have their specialty, and that's great because we need that focus when we have questions. So hope everyone enjoyed the session today, and if you have any further questions for Peoplecorp, please feel free to reach out to them or visit the Hort Protect website for more information, and that is at www.hort.com. Hort, H-O-R-T, protect.com. And just a reminder, I know there's a few people that came on a bit late. This webinar is being recorded and will be shared on the CNLA's YouTube channel. So if you'd like to watch it, I'm sure you all want to watch it again, but if some people that missed the first part, you want to watch it, by all means. And thank you for Carl and Leslie for taking the time out of your days as well to participate in this. And everyone stay safe, and thank you.
Thank you.